I want to thank you for joining us at the 11 Alert Desk. I'm digital content producer Aspen Andrews, and I am here with Chief Clinical Officer Steve Carleton at Porch Health. And January is Substance Use Treatment Month, and Steve is here to share some information about treatments and options as we start off the new year. So Steve, I'd like to start off with January is considered to be a reset month. So why is this month the perfect time to talk about these topics?
Yeah, absolutely. January is a big reset month. You see lots of New Year's resolutions. You see a lot of people setting intentions and other things they want to do differently in 2026. And relationship with substances is a common thing that comes up in January, right? Dry January is a really common thing people do. Even if you're not sort of wanting to set a full commitment to not drinking at all for the month, even though there's loads of good positive health benefits to that, it is a good time just to think about what is my relationship with alcohol and other substances, and is there something I might want to do differently.
And what does substance use disorder, also known as addiction, treatment look like?
So treatment really looks like, in the best case, it looks like coming in and talking to a professional about what is your current relationship with substances, and is there room for something different? Is there a specific change that you want to make? And treatment, oftentimes in substance use, people wait until they have a severe problem with substances before they come in, and oftentimes people are talking about abstinence. At places like Porch Health and other places around Colorado, you can also go in and talk about something called harm reduction. How do I just reduce consumption of illicit or other substances to a way that's not causing such a great impact on a person's life?
And on that note, what kinds of treatments are available for people?
So when we're talking about substance use, there's a number of different ways to think about it and a number of different things to understand and know. So the first thing we talk about is level of care, meaning are you coming in outpatient? Are you going and just meeting with a therapist once a week, twice a month, something like that? Are you looking for a more intensive program? Maybe it's 9 hours a week in an intensive outpatient program where you're really sort of focused on making more rapid changes. Is it inpatient or residential treatment, right? What people often think about as traditional rehab, you go and you live in a place for 30 days. So level of care matters. But then also you have different modalities, right? We have a number of ways that we sort of approach substance use, right? We approach it medically with medications for addiction treatment. If it's opioids, using Suboxone. For alcohol, we have medications called naltrexone and Camprol that help with cravings for alcohol. You approach it psychiatrically, right? If somebody is depressed or anxious, and that's really what's driving their use, you can take different types of medications to mitigate that depression, that anxiety, and that can help alleviate the need for more substances. And then obviously therapy, right? And so a common modality is just motivational interviewing, where the therapist is engaging with that client in a collaborative process to understand again that relationship with alcohol and what changes is that person wanting to make, and how can the therapist support those changes.
And with so many options available, what should someone look for in a treatment program?
I think there's a number of things you should look for in a program. Um, you want treatment to be evidence-based, meaning if you call and you get on the phone with somebody and you're talking to a provider, they should be able to tell you what treatment looks like, how it works, what are realistic expectations for the benefit of that treatment. So evidence-based is really important. And you want to make sure that sort of what they offer aligns with what you're wanting, right? If you're, for instance, if you're looking for a program that's going to help you reduce use and you go into an abstinence-based program like that, that's probably not going to be a good fit. You also just want to look at, are you wanting to engage in virtual care? You want to engage in person in care? Sort of just what are you looking for? And so I think those are some good questions to get you started.
And when it comes to maybe a friend or a loved one, how could you know if they might need treatment for, say, drinking too much or using drugs?
Yeah, so we're just coming off the holiday season, and it's a time when people are outside of their normal routines and schedules and structures, and you're spending more time with family and loved ones. And it might be a time when you notice behavioral change, right? That would be the biggest indicator is somebody just behaving differently, and maybe it's just very obvious, and you're noticing just a higher consumption of alcohol or some other type of substance, but looking for that behavior change, looking for just signs that maybe they're not doing as well, and they're trying to cope through substances. Those are important things to look out for.
And of course, it's always good to touch on how do people usually pay for treatments like these?
That's a great question, and obviously one that comes up a lot when people are seeking care. And so, most insurance, if you're fortunate to have insurance, does cover substance use disorder treatment, right? If you have Medicaid out there, Medicaid certainly covers substance use disorder treatment. If you have any type of commercial um, policy, those all cover substance use disorder treatment. It is a mental health condition, and so just like any other health condition, you can pay for care that way. There's also fee for service, like paying out of pocket for different if you're looking for a therapist or you have the resources to pay for treatment out of pocket. There are different options that way. And so I think those are the two most common routes. And then, the most accessible type of care available out there is still Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, the free 12-step programs that are in everyone's backyard, whether you live in Colorado Springs or you live in Gunnison or some other type of small town in Colorado. 12-step meetings are typically a part of every community, and so you can seek access to help and support that way if you don't have insurance or the ability to pay out of pocket for care.
Yeah, and especially here in Springs and Southern Colorado, how do you find treatment?
Find treatment .org is a good place to start. The SAMHSA website, Substance Abuse and Mental Health Administration, they have a good website that can help you find care. Porchlighthealth.com, we have some really good resources on there as well. Psychology Today. There's a number of different tools and places to search on the web to find treatment. And when you're looking for treatment and you're talking to whether it's a therapist or a treatment facility or clinic, it's just important to have conversations with the providers there, and if it's a fit, great, and if it's not a fit, it's always possible to stop care there and find someone new.
Awesome. Well, beginning the new year, it's such a great time to talk about substance use treatment. So thank you, Steve, for taking the time to hop on and share a little bit of insight with us.
Yeah, my pleasure, Aspen.